What are the side effects of dermal fillers and the risks? Well, we use a needle or a cannula, so both of them can cause a little bit of pain or discomfort, usually around about 3 out of 10, but everyone's pain threshold is different. You might experience some redness and some swelling, that's quite normal, but it's usually very mild. Some bruising, it does depend on your skin type as well as to whether you bruise easily. So do expect a little bit of downtime. Usually about a day or two is enough for most people. Some people will walk out of the office with absolutely nothing, not even like a hint of a bruise or a red spot. So it does depend on your skin type. Now, the other things that can happen are infection, but the skin will be cleaned very carefully beforehand. Allergic reactions, they are very rare, but they can include anaphylaxis and then delayed reactions, which happen weeks or months down the line. Obviously, as a medical doctor, I can treat both of these. They are rare, and I wouldn't expect these to happen, but we can at least be prepared if the worst was to happen. The other thing is blocking an artery. So we call this vascular occlusion. Important to be aware of. So there are arteries that carry blood around our face and carry oxygen. If you block an artery with filler, then it would block the blood supply and block the oxygen supply. And then if that was untreated, the tissue could then break down, and worst case scenario is a scar. So we can avoid this by, first of all, knowing the anatomy and the location of the main arteries. Secondly, using a cannula wherever possible. So a cannula is blunt and not sharp like a needle. So that means it's much less likely to cut through an artery. So absolutely key for some areas of the face that I use a cannula. The absolute worst case risk, which you might read about, and I believe there've been about 200 or 300 cases worldwide, and this is of blindness in relation to dermal fillers. It does sound very scary, and it would be obviously tragic if that was to happen, but it is so rare. There are also some high risk areas which we try and avoid doing of the face. Now, this would be discussed obviously at your appointments if it was one of those areas, but for example, frown lines here where there are two really important arteries that lead to the back of the eye. Try to avoid doing filler in those areas. It is done sometimes, but I will always try to use other methods to treat rather than filler in these areas.